Have you ever felt like you're doing everything right for your back? You're walking, you're doing your exercises, and even maybe you're stretching. Your disc pain improves, and then just a few weeks later, it's back. Today I want to explain why this happens and what most people are missing. Hi, I'm Dr. Matt Bradbury, family corrective chiropractor, and here we are at One Life Family Chiropractic in Georgetown, Ontario. Today, I'm going to be talking about why your disc pain keeps coming back even when you're doing everything right. And of course, if you're just tuning in, take a moment. I love being a part of your health journey. Make sure you like and subscribe so we can see more of each other along the way. Remember, in the big picture, relief is not the same necessarily as resolution. One of the biggest mistakes people make is less pain equals problem solved. But often, the pain improves before the system actually improves. The disc may be calmer, but the movement pattern may still be unchanged. Pain reduction and correction are not always the same thing. So some of the top reasons why this may potentially happen. The reason number one, you stop doing what helps in the first place. And this is incredibly common. The flare-up settles. People may stop walking during the mobility work, their stability exercises, because they feel better. Then life gets busy, and a few weeks later, hip mobility decreases, those hips get stiffer, glutes start contributing less, and the load shifts back into the spine. And the cycle starts again. Reason number two, your capacity never improved. The goal isn't just getting out of pain. The goal is increasing your capacity and being able to do more and function better for your life. Think about it for a moment. Golf, yard work, picking up the kids, long drives. If your capacity stays the same activities can potentially irritate the tissues again. Recovery without actually rebuilding capacity is temporary. Reason number three, recovery debt builds. Many people just have challenges with optimal recovery. Some examples, poor sleep, long days of just sitting and lack of movement, increased stress and inability to manage it, and just less movement overall, which are all contributing factors to poor recovery. Individually, these things may seem small. Together, they have an impact on your nervous system. You don't get that opportunity to actually recover as well as you could. The body becomes more protective, the back tightens, and symptoms potentially return. Remember, the disc is often the victim. Many people put all their focus onto the disc, but often the bigger issue is poor hip mobility, which you could be working on some of these right now as you're watching the video. Reduced glute function, and again, you could be doing some of these, working in a few sets before your workout or throughout your day. Poor movement variability, yes, you have to go from sitting to standing, move around, and get motion throughout your day. Ideally, stand most of your day. An increased stress load, which this is a tough one, but you have to become better at managing your stressors. And many things I share with you in terms of the physicality part helps improve the mentality part. You have to move to help your brain be healthy and manage stress better. The disc becomes a punching bag, if you will, and tries to absorb the extra demand. Now remember, when we're talking about discs, you can do all these other things, and many times I will see people who first reach out to me and they've done many other things. And that X factor that helps them optimize, perform better, and heal better, well, that X factor is often the chiropractor. And there's many areas you may feel, i.e. the disc, but there's also many areas you have no idea about. That's why it's so important to get tested. Remember, the nervous system is often the missing piece, and restricted spinal motion can potentially change muscle activation, load sharing, and movement quality overall. And the body may be becoming more protective. Corrective chiropractic can help restore motion and improve communication between the spine, muscles, and nervous system to help you function and optimize your health so you can move and play full out and have potentially less down days. So remember, if your disc pain keeps coming back, it doesn't mean you're broken. It usually means the system hasn't fully adapted yet. Keep building capacity, keep moving, and stay consistent long after the pain improves. Anyways, I'll leave you with that today. And remember, if you enjoyed today, I love being a part of your health journey. Make sure you take a moment, make sure you like and subscribe so we can see more of each other down the road. Get out there, do something small your future self will thank you for. And remember, you're far stronger, more resilient, and resourceful than you may be led to believe. Bye for now.